Yeah, so BeHeard Mile High actually was in response to something that the center did back in 2011. So
Mm,
the previous CEO, Grant Jones, he actually had conducted a health status survey on Denver Metro's Black church-going community. And there's really
mhm,
an opportunity for congregations to understand, for pastors and first ladies, or all different church and faith leaders to actually understand a little bit more about their congregation's health status and some of their needs. So when I came back, I believe it was a little over 1,500 to 2,000 responses we've gotten just on that survey back in 2011. And that kind of sparked an idea around like really just us as an organization creating like a feedback channel for community to talk about their issues and to talk a little bit about just their experiences. So it's a good way to update the status of different things. But a lot of times it's around health focus, but we think also around social determinants of health. And I'll talk a little bit more about that too.
mhm.
But the original survey talked about health status, talked about insurance, talked about barriers and issues. So it's a lot of the same stuff we're talking about now. The social determinants of health is kind of like that buzzword that's used around it, but our surveys are shaped around that to ask in different areas of health and well-being. What's going on in your life? What are your needs? What are your perceptions, behaviors? What are some patterns
Mhm.
maybe you recognize as a community member? We get information about where they're calling from as far as geographics, and then also some of their demographics as well. So this really just brought an idea of just how do we make sure that we can use community informed data to create change in the community. So some of that, at the time, actually, the city of Denver conducted a similar survey on community members, just like a community needs assessment. And they had about 400 respondents from that Black or African American community. So it showed a great disparity as far as, like really like when we trying to ask community what they need, what is it that exactly is the barrier for us to get that information? And, our current executive director, Deidre Johnson, she likes to say, she says specifically, sometimes to hear a community, you just have to be the right one asking the questions. And that was one thing that 2011 survey helped us learn as an organization was that, that depending on who's asking the questions, we can understand, we can actually reach the audiences because we're a lot more of a trusted source. And when we think about our community, especially when it comes to healthcare systems, there's a lot of mistrust historically and currently, with those systems and also abuse in those systems. So to a lot of community members, it's justified to have that mistrust. And, for us is really just trying to understand, how can we make sure that we can still have community members navigate through systems of health, that we can help them reach that highest level of health and well-being. With public health, that's all you're trying to do is try to achieve that.